Someone once said, if we could take all of the world's problems and put them into a pile and then choose the ones we want, we would be most likely to choose our own.
I always thought I was going to be in aviation. And so I grew up on a little grass strip in Louisiana, and I wound up soloing on my 16th birthday, at which point then, our family had economic challenges, and I did not have support to go to college. So I wound up joining the Army when I was 17 and went to flight school. And I was a helicopter pilot in the Army. And so then when I got out of the service in 74, I came back and went to Athens, Georgia, and went through school there. And then I had my airline applications and my medical school applications in at the same time, and medicine came back first. And so anesthesia is just like flying, that you've got hours and hours of boredom with moments of stark terror. So it was just a natural to roll into that specialty. Well, that lasted until my episode with my chronic pain and disability.
During his late 30s, while on vacation with his family, Dr. Thacker had been carrying his then 6-year-old daughter Ashley on his shoulders, when all of a sudden he felt a popping sensation in his back. He didn't think much of it until it occurred again a month later, and this time it would be life-changing.
I wound up waking up about 4:30 in the morning, and I woke Sandra up, my wife, and I said, I can't use the bathroom. I'm in urinary retention. I can't stand up. And at that moment in time when my pain was so excruciating, I was ready to do whatever it took to get pain relief. I had my third back surgery. We'd been out of work for about 6 months, I thought. And you just kind of feel worthless and helpless, and all those emotions about, well, how am I going to provide? How are we going to keep all this going? How is this all going to work? I mean, this became a very serious job to get my physical condition back so that I could function and I could provide for my family. The Saturday afternoon on December 17th, 2005 was one of those moments that will always be embedded. We got that phone call that you never want to get. Our daughter had been up snowboarding with her boyfriend, and on their way home, he was driving and had fallen asleep. They ran off the road and they took out 16 guard posts in Idaho Springs, Colorado. The phone call I got was from James. He was in tears, saying, I've killed her. I've killed her. I knew that wasn't correct. Because I heard Ashley in the background. And she was coherent, and she was talking. They were taking them to St. Anthony Central Hospital. And I didn't know where that was. We had multiple serious injuries. We spent the next 13 days in ICU. with her on a ventilator. She woke up Christmas Day, and she did not know who she was until January the 3rd. My back was secondary in my thoughts at that point, but I recognized that I was not going to be able to function if I didn't get some relief, because as a solo provider, I had to work. I had to try to produce, because we were into a long ride with Ashley. I left Sandra in ICU with Ashley, and I flew to California. I was so miserable driving the rental car, I was in tears. I arrived Sunday afternoon. I was evaluated all day Monday. Tuesday, I had surgery, 3-level disectomy. Wednesday morning, I got up. I was pain-free the first time in years. I drove myself back to the airport and flew home Wednesday night. I was able to sit on the airliner the first time without pain.
Dr. Thacker and his wife Sandra got Ashley moved into a rehab facility, and because of her broken pelvis, they had to help move her around. One time while moving her, Dr. Thacker blew out another disc, which would now throw him into his 5th back surgery.
The path that our lives have taken, with Jim personally enduring pain and being incapacitated, and then watching our daughter for the last 6 years live a day-to-day existence that's filled with pain and fear, has allowed Jim to look at each patient as an individual, a patient that is someone's mother, sister, father, or brother, and take all of our experiences and all of his training and to try to focus on that individual and create a future in which that patient can find joy again.
I wasn't happy with the basically the rehab program I had been given, and we were doing a lot of back surgery for people. So I was seeing a lot of people with spine surgery, and then I was seeing them come back for their next surgery, and then I saw the spiral that was going on. And then when I experienced that myself, I said, I cannot do this. We've got to find a better way. And so I began my quest to find alternatives that would provide me with the relief. And because I knew that once I had relief, then I could transfer that to others. So I became board certified in pain management, and then later certified in interventional pain management. And so I was able to marry the different Eastern techniques and Western techniques, and which gave us a whole nother set of tools to work with for chronic pain management and trying to get people better. Through our experience with Ashley and her 61 surgeries, we've come to have great empathy for pain. I think over time I've become much more patient with my reactions, or maybe more controlled.
Jim and I have been married 32 years, so we've been through a lot together. He's focused, he's determined, he's strong, and as long as you believe in him and believe in yourself, then he supports you. He supports the future.